Hello, everyone. So I take this opportunity to welcome all the new medicos into this rocking profession. I know a lot of you have joined MBBS today or in this week. Some of you will be joining, and many of you are, in still in two minds. Although you have joined the medical profession, you have joined the MBBS, but you're still in two minds. Have I done the right thing or not? Some people are telling me it's a long journey. Some people are telling me it is hard work. I am here to tell you it is hard work. It is a long journey, but over and above it, it is worth it. It's a beautiful journey, and in this journey you will be learning a lot about human body in both in health and disease. It will be a gratifying journey where you will be touching many lives. And in this entire journey, as a medical student, as a doctor, there will be many exams which will be taken in the way to ensure that you are at that topmost quality, at that topmost level to treat the patients. So what will happen is after your first year, you will have an exam called as first professional exam. After your second year, you will have an exam called as second professional. In the first year, there will be anatomy, biochemistry, physiology. In the second year, there will be pathology, pharmacology, microbiology. But important thing is that National Medical Commission has recently announced that at the end of second year, you will have an exam called as next stage 1, in which pre and paraclinicals will be tested for your licensing purpose as well. Then you will go into your third year where you will have ophthalmology, ENT and community medicine. Fourth year, you will have medicine, surgery, obs, gynae, pediatrics and all the short subjects. At the end of third and fourth year, you will have, at the end of third year, third prof, fourth year, fourth prof, and then you will have next part 2, where you will be tested for the clinical subjects. Then you will do your internship. After the end of internship, there will be another part of next, which will test you for your practical. So this is a new generation of exams that is happening in India, where you will be tested both for your degree as well as for your license separately. The professional exams that are taken for degree, and the licensing exam, which is called as the national exit exam, for which the announcements will be released in this year, is called as next, which is a licentiate exam. And next is not only a licensing exam for Indian graduates, it is also the licensing exam for foreign medical graduates. And the score that you get in the part 2 of this paper will be also used. The score that you get in the clinical part will also be used for your PG seat, will also be used for your, in which college will you do your post graduation from and which subject you can take. So although medical profession has its own charm, its own, the ability to touch lives, but it has a lot of standards to keep up to, and in which you have to appear for exams at various levels. Not only in India, such exams are taken world over. So what is my goal today is I wanted to, give you an overview of what to expect in these exams. But I also want you to, look at this entire process as a journey. Although, you might be looking at ke, bas ek baar MBBS mein aa jaye, fir zindagi safal ho jayegi, that, once I enter MBBS, everything will be okay. But the important thing is that it is a journey. It is not a destination. So here onwards, you are actually beginning a journey where you will learn a lot of new things every single day of your life. So you have to change and retune your mindset to the journey or growth mindset. Now, I also want to take this opportunity to introduce you to DAMS. DAMS was established in 1999 as a coaching institute for NEET PG, and we have been doing this for last 22 years now. And recently we have launched a special program for first year MBBS, because in first year MBBS now you have a new curriculum called as competency based medical education curriculum, and which is more clinical, and it all stresses on clinical exposure from the first year itself. So to help students who are studying all over India in diverse medical colleges, or all over world in different medical colleges across the world, who seek to practice in India later on, you have to study at a standardized level. For that, we introduced a program for first year on our eMedicoz app called as First Year Tuitions, which is a live and interactive course which is starting today. The first lecture of this season's tuition classes, first year tuition classes, will start today. And to know more about this course, I will invite the esteemed faculty members on this program to, give you insight into the course. Let me introduce to you Dr. Anupama Devgan. She is going to teach you physiology, and she is also going to orient you today about, her perspective of the, first year, and how to, study in first year. And to set the ball rolling, let me give you a, small idea about how, good a teacher she is. That every year for last, so many years, and probably a decades, I have been hearing from students who study from her that there could be no better physiology teacher than Dr. Anupama in the entire planet. Although, we do not have people on Mars so far. So entire planet, we don't have a better physiology teacher. All over to you, Dr. Anupama. Please guide the new fledglings into this profession.
Thank you, Dr. Sumer, for your kind words. And let me introduce myself. I'm Dr. Anupama Devgan, and I have been with DAMS for the last 17 years. So this is my 17th year with DAMS, and I welcome our new entrants into the medical profession, all the newbies in the first year who have just joined. I will be taking your physiology lectures, physiology classes. Now, these classes are like Dr. Sumer had said, that this is a journey. It's not a destination, and it is a tough journey. There is no doubt about that. This is a tough journey, and we are there to hold your hand as you move along in these different, from one year to the next. Now, as far as physiology is concerned, physiology is completely a concept-based subject. We have two exceedingly fantastic books, standard textbooks in physiology. One of them, I'm sure you must have heard of it by now, Guyton and Genong. There are generations of medical students and professionals, medical professionals, who swear by these books. These are excellent books. But again, a little difficult to understand. Like I said, what our aim is going to be to simplify these concepts that you're going to be reading in these books, to help you understand them, to help you retain all that information, what is the best way to retain that, and also how you should be able to answer these in not just your professional exams, your university exams, but also when you attempt your next part one. So the aim is going to be basically to hold your hand, to guide you through this maze of information that you're going to be exposed to in the coming years, and especially in the first year. Now, anatomy, physiology, biochemistry, these are literally going to be the pillars of your medical education. These are your foundation subjects. This is what you're going to, these three subjects are what you're going to build your medical knowledge on. So it obviously, it goes without saying that the foundation has to be really strong, sturdy, to be able to support the entire building. And that's exactly what we are going to do. We are going to help you build up a very, very strong foundation, strong concepts. We would, so that your journey ahead also becomes easier. Your ability to answer questions in the university exam, not just your theory questions, even your practicals. We'll help you, we'll guide you through the, with your practicals, with your viva voce questions. So the aim is basically to hold your hand through this journey. The best part and the feedback that we got from the students in the last year was, in 2021, was that since these are live classes, they were able to ask even their smallest doubts. All their doubts were addressed. We helped them understand the subject much better. And there was something very interesting, one of the students has said that since we are not really judging them, they felt free to ask even the smallest and sometimes even a silly doubt. What they thought was a silly doubt, they could still ask us that. So this was something which they thought they couldn't ask their own faculty in their medical college. So that was something very heartening to hear, that they had that confidence that even their smallest doubt will be sorted out here in DAMS. Now, these classes will be conducted in the evenings from 9 to 10:30 p.m. So that means this is after your day is over, you've finished with your, uh, you've had your dinner, you've finished with your day's activities, and you sit down with your mobile phone or your device in front of you, and we will then we will hold these classes from, like I said, 9 to 10:30 p.m. And this is on weekdays. Now, after every topic is complete, I will also be giving you an MCQ test. We will also, so that, and not only will you be answering those MCQs, we'll also be discussing them. So that will be another way in which your doubts will be cleared. Dr. Sumer had mentioned that the medical curriculum in India has undergone a sea change. There has been the introduction of the competency-based medical education. And the curriculum has been tailored towards that. So our classes will be adhering to the guidelines which are laid down in the competency-based medical education curriculum. This applies not only to the theory, also to the practicals. This is as far as your physiology is concerned. You also have two more subjects, that is anatomy and biochemistry. I will now invite Dr. Sandeep Madaan. He's a leading anatomy faculty in the country and with DAMS for the last so many years now. And Dr. Madaan, please tell our students about anatomy and how you will be conducting your classes.
Thank you so much, ma'am, for your kind words. And I welcome all of new entrants to this new world. And as we say, hard work always pays off. You have worked really hard to get, you see, a medical seat, which was your dream, right? So first of all, I welcome, and it was your hard work, your teachers and parents' blessing, and the God's grace that has made you successful. But let me also tell you, this is not the end, but this is the beginning of new journey, right? As Sumer sir and Anupama ma'am have already, you see, explained about the journey and how we are going to help you guys, how we are going to guide you guys, right? So let me tell you, I will be taking your anatomy classes, okay? And uh, also at the same time, we will be teaching you, at the same time, we will be guiding you, because this is the stage where you really need someone to guide you, someone to show you the path, okay? What to do and what not to do, all right? There will be so many distractions in this journey, okay? And you have to always keep yourself focused on the studies, and you really should be prepared to work hard, okay? And we will be guiding you. And so far as anatomy is concerned, we have standard textbooks, Gray's Anatomy, and there is another version, Gray's Anatomy for students, okay? That has been specifically made for the students so that they can see very beautiful pictures have been added there. You can use that book as atlas. I will be also guiding all throughout the classes, okay, which atlas or what pictures, and also we will be reading the other standard textbooks like Langman's embryology. And in different colleges, the textbooks used are like B.D. Chaurasia and the Vishram Singh, and other books are also there. But our classes will be based on all the standard textbooks, because even if the students they themselves are not studying from the standard textbooks, at least they will be having the gist from them, okay? And I know many of you dream about becoming a big neurosurgeon, big cardiac surgeon, right? So to become a good neurosurgeon, you should have a good basic knowledge, good foundation in the neuroanatomy. Once you know the neuroanatomy, right? Once you know which structure is present where, accordingly you can diagnose it, accordingly you can treat it. So to become a good clinician, you should have very good foundation. So this is our role, to give you the clear picture. And also I will tell all my students that we should never do the pure mugging up, okay? We should always first understand the concept in a concise way, and then we try to remember it and we try to retain it. So that understanding and remembering is way better than pure mugging up, where we don't even have any idea of the structure, right? I hope you understood that. So we will be going through this journey together. We will be guiding you, and we will be taking the classes on like Monday to Friday. And today I will be beginning with the anatomy, and I will be beginning with the very basic things so that it becomes very easy, and slowly we will be picking up the pace, and we'll be finishing the syllabus. We will be covering theory as well as practicals, right? And I wish you all the best. And now I invite Sumer sir. Now Sumer sir have more than 2 decades of experience of guiding the students, teaching the students, right? So I request Sumer sir now.
Thank you, Dr. Sandeep. And so, as we were discussing that the medical education curriculum in India has changed. And at DAMS, we have seen this change happening for last 22 years. When we started DAMS, there was, a very few people could understand the need for supplemental education for doctors. And today it is a mainstream concept. Similarly, when we started live teaching on the eMedicoz app, all the other apps, all the other resources were offering recorded or pre-recorded lectures. And, it's like it's a sea change in the way we deliver online or e-learning, for medical students. It is live, interactive. These are short lectures which will happen in comfortable timings after college hours for you, where you would have time to interact with the teacher, ask your doubt, assimilate everything that you really dream about doing in a medical college, but you are unable to do because the teacher-student relationship is very formal. Here, it is a very informal kind of a relationship where you can ask your doubts, you can solve your queries. Like Dr. Anupama said, like Dr. Sandeep said, that there is no doubt which is silly. Everything that needs to be cleared, and we will help with the teaching faculty, giving you ample time in every lecture for doubt solving. We will base our anatomy, physiology, biochemistry teaching on standard textbooks like Gray's Anatomy, like Harper's, like Guyton, Genong, Lippincott. We will be basing our teaching on the standard most books, and everything will be dealt with a clinical orientation in mind. Because today we know the National Medical Commission is insisting on early clinical exposure for medical students, and you need to have that ability to think clinically rather than thinking like a say a science graduate or a PhD student. You're a doctor, so you need to know clinical relevance of every fact that you're reading. This course will be supplemented by study material as well. For you will be getting your study material for anatomy, which is called as for biochemistry, physiology is called as our DAMS concept books, which will be fully colored with images. All the most important points will be given in this book, so that it will also be a ready reference book for you. You will also be given access to the question bank, so that you can online practice question bank in your mobile phone, and periodic tests will be taken in this course. To make sure that you are able to see the course before you decide to subscribe this course, we have opened a free trial period till 20th of March. You can download the eMedicoz app from your Play Store or your the App Store on Apple or on your Android phones, and go and subscribe to download the eMedicoz app and create a it's a free registration. You can create a free registration. You will find a variety of free resources on the app, including free articles, news, podcast, free videos to learn from. Plus you will see a lot of courses. In those courses, I want you to go to the tuition courses and select first year tuition course and enroll for the free trial, which is there till 20th of March, and start accessing from today itself, so that you don't take a blind plunge into any program. You see what is happening. You can attend today's class with Dr. Sandeep, see the basics of anatomy. The beauty of our course is that it is timed with the way the medical college functions. So we will start a little slow so that you get warmed up to the feeling of medical education, and then we will increase the momentum. Plus, another beautiful thing that we have done this year is on the day one of joining itself, the entire set of lectures conducted in the last cycle are also accessible to you. So that if suppose we are teaching you anatomy or thoracic anatomy in DAMS, and in your college they are doing upper limb, and you want to see the upper limb videos, that is also possible. So day one, you get all the 3 subjects fully covered videos of the last cycle with you, and plus another cycle of live cycles of live classes will happen with you. So it is one place where everything you need in your first year is there. You will have study material, you will have question banks, you will have tests, video lectures, recorded access, live lectures. Whatever live lecture will be conducted will also be uploaded, recorded for you. And I just wanted to leave you a thought that when I came into medical school, the reason I came into medical school is because I seek more out of life. I want to know more. I want to touch more lives. And I came from an average school, and I ended up getting a top 5 rank in my All India PMT exam. And I joined Maulana Azad Medical College for my graduation. And every few months I met people who were negative. Every few weeks I met people or colleagues who were negative, or who said, this is a mistake, this is too long, this, and doctors are not treated well, and all those things were happening around me. But I kept moving forward, and today I am at a position to tell you that you have made a right decision. It's a great profession, well respected. There are sporadic 1 or 2 incidents that happen which might be discouraging to hear, but I'm telling you, they are a minority. Vast majority respects doctors and medical profession like, like you have heard of and like you have dreamt of. The only thing that this profession needs is, it needs a bit of hard work, because you are going to be dealing with human life every single day of your life. And when you're dealing with human life, you are not supposed to be average, good. You're supposed to be the best possible available doctor for the patient. So always think about it with, keep your relative or somebody you love in front of you, and then think, if they need a doctor, what kind of doctor do they need? You need a best doctor for your loved ones. So you want to become that kind of hero. You want to become that kind of best doctor for your loved ones. We are here to mentor you on each step. In DAMS, we have programs which start at first MBBS. Then we have programs for second MBBS. We have programs for third, fourth MBBS. We have special test and discussion courses later on for internship. We have, we have fast track courses, revision courses. We have a plethora of courses tailored for every step of MBBS. Not just MBBS, we have courses even for resident doctors who are pursuing MD, DNB or MS later on. And we have also CME, continuous medical education courses for practicing doctors. So we seek to become your education partner for life. And with that note, I invite you to today's session on eMedicoz app. Download the eMedicoz app and start learning today. Free trial is available till March 20th.
So I extend a very warm welcome to all the fresh entrants into the medical profession. And like we've already told you, we are there to hold your hand through this journey and make life easier in medical colleges, and even even your life outside that.
So again, I welcome all of you, and today we are going to begin this beautiful journey, and I am eager to wait you guys to meet you guys across the screen. And as this will be a live and interactive class, as and when you have any doubt in any of the topics, you feel free to ask us. Okay. So because we will be keeping all the lectures in an informal way, so feel free to contact us. So I'll be starting the class today. So download the app.
What time do we start, Dr. Sandeep? What time do we start the lecture?
Sir, 9.
So see you at 9 p.m. today on eMedicoz app.
See you guys.